And over in the western region, health officials say they're putting plans in place as they brace for a further increase in COVID-19 admissions. Vashon Brown has that angle.
A rapid increase in COVID-19 cases and hospitalizations, but officials in the western region say this is what they have noticed.
In the last pandemic, the patients that were hospitalized, they needed, high flow oxygen. We are seeing that these patients, they are not needing a high volume of high flow oxygen. So the most of the patients were on 2 or 3 liters, and that was maintaining them at the physiologic state that we'll want them to be.
Still, the clinical coordinator for the Western Regional Health Authority, Dr. Delroy Frey, argues that there is no room for complacency.
What we are seeing in the east, I believe, will move here over the next few days. And so we are in preparation to deal with an increased admission if the need should arise.
Like other health regions, nurses and doctors out west have been in quarantine or isolation.
The situation as it stands in the western region as of yesterday at 5 p.m. is as follows. At Cornwall Regional, we had 21 doctors off work, 46 nursing staff who were caring for about 44 positive COVID patients with 20 suspects. And the total number of staff that was off was 77. That's a little bit encouraging because previously we had a total staff off of about 90. So although not very significant, but important to know that we are seeing a fall there.
And at the Savannah Lamar Hospital in Westmoreland,
there were 5 doctors off, 27 nursing staff with 18 positive COVID patients and 12 suspects. At the Noel Homes, there was no doctor off, 1 nurse off with 12 positive COVID patients. And at the Falmouth Hospital, there were 2 doctors off, 18 nursing staff, and they were caring for 22 positive patients with 14 suspected patients.
yesterday we reported that a significant number of healthcare workers who've contracted the virus are not vaccinated, renewing concerns about vaccine hesitancy among people on the front line.
Over 90% of our doctors are vaccinated, and a good number of them have taken the booster as well. And the last check, I noticed that there was probably up to about 50 to 60% of the nurses were vaccinated. Now, because of what is happening in the country, and we emphasize this every day, we encourage our staff to go out and get vaccinated.
Vashon Brown, TVJ News.